and that's out with a 3-0 recommendation. Moving on, as noted in our agenda, to the last section under Part A, which is Community Services.
Thank you, Madam Chair. The agenda accurately reflects the proposed adjustments that are in the May revision for regional center operations expenditures and purchase of service expenditures. Both the expenditure numbers and the funding are accurately reflected for both current year and budget year. The total May revision budget is looking at a current year deficiency of $43.4 million, of which $41.7 million is general fund. And for 15-16, we're looking at a total of $247.7 million total, and then $211.9 million general fund. The growth in our base numbers continues, and we're seeing increased expenditures and caseload. A lot of it is related to community care facilities, support services, and health care, which is consistent with moving more individuals into the community that have enduring medical needs and challenging behavioral issues. We also understand the LAO's concern that is pointed out here. We appreciate the concern about non-matched general fund expenditures that are not drawing down federal funds, and it's something we will be continuing to work on with the LAO and with the Department of Finance.
Thank you. LAO.
Sean Martin, Legislative Analyst Office. We've reviewed the caseload for the community program, and we're not recommending any adjustments at this time. As the department just said, we've raised concerns with the amount of federal funding that the department is drawing down for community care facilities and supported living services. That's a trend that we identified when we looked at the January 10 governor's budget. We still see that trend in their estimate. We've been in discussions with the department to try and identify what's the cause of it. In part, it may be that the amount of federal funds that were projected were overstated in prior years. We note that there are prior year deficiencies, and that may be part of the cause. We've agreed to continue to work with the department to try and get to the bottom of this, and the department has indicated that this is a high priority for them this summer.
Finance. Public comment. Public comment on issue number 1, the current year deficiency and budget year increase.
With your permission, I'm going to jump to a statement because I have to pick up my kids.
Okay, well, wait, you're jumping to where?
I just want to jump into my comment. I'm not sure it fits right here.
Got it. Identify who you are.
Eric Stern. I'm a case manager at the Regional Center of the East Bay, and I'm the chair of the SEIU California DD Council. So on behalf of 4,000 SEIU Regional Center and vendor agency workers, I want to thank this committee from the bottom of my heart for your clear concern for the DD system. As it teeters on the brink of collapse, I just have to say we need that 10% increase that the Landerman Coalition is asking for. We need it this year. Thank you so much.
Thank you very much. Appreciate that. Are you coming on this agenda item? Yes, thank you.
Clearly, in the struggles we have in the community, if the LAO's recommendation is to not provide this additional funding, that means the regional centers will be under even greater stress, which means providers will be under greater stress. Understand the need for reimbursement, and we would like to pursue that, but the dollars are needed today to keep the system moving.
Thank you. With that, again, on the top of page 37 of the agenda, I will make a motion that we approve the May revise, adjusted for any actions adopted elsewhere in the agenda, and again request that DDS and LAO report back to the subcommittee next year on the issue of the federal matching funds estimate methodology. That's out with the 3-0 recommendation. Issue number 2, continuation costs for residents transitioning from a DC into the community.
Yes, thank you. So continuation costs are actually those costs for the individuals who've transitioned from a developmental center to the community in the second year of the date of when the individual has moved. So just give a little explanation behind that. So the cost associated with the first year of placement, once somebody has moved to the community from a developmental center, is covered under the community placement plan funds. The second year, of which I said is the continuation cost. The third year At that point, we have the expenditures in the trends, and so it's captured. So in the governor's budget, we had $4 million. However, the methodology to get to the $4 million is an old methodology. What we're looking at now is recognizing that the actual cost of every individual who does move to the community and the associated cost with that, recognizing what those costs are, we're requesting in current year $21.4 million above the governor's budget. In budget year, 37.9 increase over governor's budget.
LAO.
No issues to raise.
Finance. Public comment.
Will Sanford, I'm almost getting a little smarter, I got up earlier. My question would go to the LEO's point before. These are individuals who are moving from a developmental center. Therefore, they would be institutionally deemed. Therefore, why is not half of that being funded from the federal Medicaid waiver versus so much general fund?
So the projections, the projections are also including the portion that we have for money follows a person. So we do account for the federal funding.
Move it.
Okay. The recommendation is to approve the May revise, and we'll do that with a 3-0 recommendation. Issue number 3, general fund offset due to reduction in revenues from the Program Development Fund.
This issue proposes to adjust the department's budget due to decreases that we're seeing in both the annual family program fee and the parental fee. These two fees are collected in the Program Development Fund, and we're seeing lower than expected numbers as far as revenues coming in. So what we're proposing is in 14-15, we're requesting 1.3 million general fund to offset approximately 300,000 in the annual family program fee that won't be coming in, and approximately $1 million in the parental fee. In 15-16, we're requesting an adjustment of 1.4 million. Of approximately 400,000 of that is coming from the annual family program fee, and the other 1 million is coming from the parental fee. What we're seeing in the annual family program fee is a lower number of eligible children, fewer assessments by regional centers, and we're updating our collection information for actuals. And on the parental fee program, we're seeing lower than expected collections, and we had planned to have a credit card payment option in place last fall, and that was delayed, so that's reduced some of our revenues.
You have a new projected delivery day, if you will, for your credit card payment implementation?
It's up and running now.
It's up and running now, so it was just delayed. Great, excellent. LAO? Finance? Is that your finger up as you want to speak, Senator Stone?
No.
No, okay, thank you. Public comment on issue number 3. Seeing none, I'll entertain a motion that we approve the May revise, again, asking DDS to report back. And it may not even be during the budget hearing process, but maybe early in 2016. There's so many issues that we're asking various departments within our scope to report back on that we may look at, an early in the year sub-3 hearing before we get into the meat of the budget to really have a meaningful conversation on many of these issues we've asked various departments to report back on. And so this would certainly fall in that category. Thank you very much. That's out with the 3-0 recommendation. Issue number 4, federal overtime changes.
So as the agenda correctly points out, the overtime changes to the Fair Labor Standards Act were put on hold by the court. And so what the department has done for the current year, we had approximately $21 million in the budget. 11 million of that was general fund. We are proposing to remove that as part of the May revision because it's very unlikely that there will be any settlement in this current year. In the 15-16 budget, we have a slight adjustment as part of May revision. but the May revision budget in total proposes $43.3 million to implement the overtime rule, depending on the decision by the court.
LAO.
We note that there is considerable uncertainty surrounding the appeals court when it will make its decision on the regulations, how the case will be decided, and therefore whether the full amount of money that's included in the budget will be needed in the budget year.
Thank you. Finance. Public comment. Like 5 minutes.
Hi, my name is Nicole Buslock, and I am here on behalf of my staff. If I am sick, I have problems with finding staff because my overnight staff cannot get paid for overtime. So please, please remember me when you're thinking of the budget for overtime.
Thank you very much. Page 39 of the agenda, I'll entertain a motion that we adopt trailer bill language that in the event of the Fair Labor Standards Act regulation is implemented, DDS shall work with ledge staff providers, the Association of Regional Centers to establish and implement a strategy for monitoring the impact of the regulation on consumers and providers and present the findings of the monitoring during the 2016 budget subcommittee process.
So moved. Madam Chair, I
Yes.
support the trailer language, but not the expenditure of the funds at this time, so I'll have thumbs down on this one.
Okay, and that's out with a 2-to-1 recommendation. Issue number 5, prior year's general fund shortfall.
What the May revision proposes is an appropriation in fiscal year 2015-16 of $61.6 million. This funding would be used to repay prior year general fund loans from 11-12 and 12-13. The 11-12 amount is $15.6 million, and the 12-13 amount is $46 million. What the department has been able to do is to go back to fiscal year 2009-10 to bill for services that are eligible for federal financial participation. So for day programs and transportation services, we've been able to go back and bill for those years. And it's brought in millions of dollars in federal funds that we're able to offset general fund expenditures. However, some of our estimates in the later years were not as accurate as we would have liked. We did overestimate some of the revenues that were expected to come in, and this deficiency request is part of that. So that's why we need these funds to repay those general fund loans.
LAO?
Sean Martin with the Legislative Analyst's Office. We're not raising any issues with this at this time, but we intend to look at it further and get a better understanding of what happened in those prior years regarding the federal funds issue that we discussed earlier.
Finance? Public, Senator Stone.
Yeah, thank you. We're going back to 2009, 2010. What took so long to discover this shortfall error?
It's a fairly complicated process, Senator, and I won't bore you with all the accounting details, but what what the department is able to do is to go back to years that have been closed, and we're able to bill for those. We're still billing for 11, 12, 12, 13, and 13, 14. Those billings will end, I believe, in the next year or two. But it's the complication with trying to estimate how much you may have spent on these particular services in those years. So, as I said, in some of the earlier years, we brought in more general fund than we needed, but it was scored as savings at that time against the general fund. So if we actually brought in enough to cover these kinds of deficiencies, but the savings had already been scored in the general fund.
Are we still able to extract any money from the federal government if?
Yes, and we're continuing
within a 2-year period of time?
Yes, we're continuing to bill for those services.
Okay, thank you.
LAO, we did that already. Public comment. Seeing none, again, on page 39 of the agenda, I'll recommend approval of the May revise. And that's out with a 2-0 recommendation. Moving on to issue number 6, stability of community-based services and support. Right.
This is public comment.
Say it one more time.
And that's what we're holding it open until.
Okay, I'm waiting for them to. Oh, this is the ledge proposal. So who's intends to present it?
Nobody needs to present at this stage. We've already heard.
Got you. Sorry. No wonder you were looking at me. Like, why is she just sitting there? We're going to take public comment on this item. The public knew they queued up. We're going to leave this item open until our closeout hearing on Thursday, but we're going to take public comment now. So again, it's item 6, stability of community-based services and supports.
It's me again. Keep the promise and add the 10%. I am losing staff because they can't afford to feed their children. Please remember me because I can't lose any more staff.
Thank you very much. Next witness.
Just keep the promise of the Lanham Act. Audra.
Keep the promise of the Lanham Act. I am Audra.
Thank you, Audra. Next witness.
Hi, it's Sue North with CDSA. Just very quickly, in all of the meetings that we've been doing around the Capitol in many, many offices, one of the many themes that has struck time and again is the fact that over the last decade, we've seen a quiet, subtle deterioration of smaller providers throughout the state. That for many, many decades was kind of the backbone of service delivery, personalized, neighborhood-based, community-based. So those providers that are left now have spent their reserves and they're larger. So the next level of people falling off the cliff are going to have very catastrophic impacts on the service systems in those local communities. Yesterday in the assembly, I mentioned that I'd gotten an email from one of our members who runs a program in Marin, where 2 transportation providers have recently gone under. There are 170 consumers in that part of California right now that have lost their access to the community, in effect. So the kinds of conditions that we're seeing are of much greater consequence. And the system cannot go on without some pretty dramatic damage being done, very much longer. So we're appealing to you. The 10% is more than justified, but we absolutely have to have something right now, not wait another year.
Thank you. Next witness.
Hi, I'm Audrey Deschadnin, my daughter Valerie. Without sufficient pay, service providers can't retain qualified staff, and they have to either reduce services in the amount or the quality of the services. In the last 6 months, we've seen staff turnover in my daughter's day program. 3 times people have moved and changed, and we've had to change her people. And I have to mention, this is the only day program she can stay in. There's no other options for her, so the amount of choices have been reduced as well. We've also seen the bus company that's carried her to and from her day program for 3 years close. The new company is already struggling, and we've had some days where they haven't been able to pick her up. She has no place to live. We have precious few choices of supported living programs, and even that's shifting under our feet as we go. I could go on and on about this, but I know you know programs are falling apart, and it's the 11th hour. We need help now. Thank you.
Thank you.
Hello, my name is Aaron Kitzman. I work at Villa Esperanza Services. We're a community-based nonprofit in Ventura and Los Angeles counties. I'm not going to go into the specifics of why we need more money, although we do, because there's a long line, and I'm sure they're all going to tell you. I'm going to actually ask something of you, and that is other than the money, because last year I was here, and I heard several members of this committee, as well as on the assembly side, agree with us that we needed more money. My understanding is it was actually put in the budget, and then at the last minute, the governor or somebody got rid of it. So what I'm asking this time is, yesterday I heard in the assembly, very much in support, both Mr. Thurman and Ms. Grove were very, very strong in their statement. I'm assuming, since you thought we needed more money last year, that you will agree we need even more this year. So my request to you is to be strong, and when the governor or somebody else says, no, we want to give the money to somewhere else, to some other system, that you stand up and say, no, this system has been without for years and years, there's $1 billion missing, et cetera, et cetera. We really need you to stand strong. We are in trouble right now.
I appreciate that, and let me be clear, there's only one person in the state who has a blue pencil. So as you say, you're not quite sure who lost it. There's one person who has
And I absolutely appreciate
line item veto authority.
I absolutely appreciate that.
And it's not me.
But I know there's always a negotiation with the governor, and so I'm just hoping that you're able to stay strong for us.
Thank you very much. Appreciate that perspective. Next witness.
Thank you. Eileen Ritchie, ARCA. I want to echo all of the comments before me. Our service system can't wait another year. I've had many service providers and regional center directors tell us that we can't hold on another year. Providers are going to be closing. We have higher than legal caseloads, and we are jeopardizing our $2 billion in federal funds. So I ask you to act today. Thank you.
Thank you. Next witness.
Hi, I'm Mary Brett. I'm the Director of Community Access, Supported Living, and Partners ILS. I was here in March, and I'm back again. Echoing what everyone has said, we cannot do this anymore. Every year, there is no money, there's no additional funding, and we all keep struggling and staggering on. I can't pay my staff developmental center level wages. It's hard for me to keep staff. And in the end, it's the consumers who end up suffering. I've already told, one of the case managers at our CEB, I cannot take any more supported living clients. I cannot afford to. I would love to, but I can't, because that would mean I would need to hire another supervisor. I can't afford that. So in the end, everyone's suffering. And I know it's Jerry Brown who holds that blue pencil, but he really needs to be held accountable for this. He really needs to be held accountable, because this has gotten worse during his administration. And I know he's the bottom line, but I'm trusting that you will do whatever you can, each of you, to really try to start making things right, because the system is falling apart. It's failing.
Thank you.
Thanks.
Hi, my name is Jackie Dillard-Foss. I was told yesterday, as the CEO of STEP, is that I had to, and it really gets to me, that I had to tell my folks that they need to come and say they're going to lose their housing, or they're going to lose their supported living arrangement. And I'm tired of begging. I really am. Because I used to be able to be that agency that would take on those supported living arrangements, and I can't. My turnover rate's worse than it's ever been. When I go to the developmental center, do I look at them and go, I can do that? I do that. I can do that. We do that. They get hired at $10.50. January 1st, minimum wage is at $10. Those are for my staff that sleep. For my staff that are going to work with complex folks, I have to say you get paid $10.50 an hour. It's an embarrassment. We see these counties fighting for $15 an hour. I have supported living providers in the Bay Area where these counties' wages went up. They have to do health and safety waivers with DDS. Why? They're breaking the law if they don't pay 15. They tell me I'm making business decisions to pay my supervisory staff minimum ×2 when the state of California writes it into their wage order. I have the FLSA, I have unfunded mandates, I have $10 an hour, I have a turnover rate, I have people, and I'm supposed to scare my people. Do you know, that's not what we do. We as a community, we don't scare our folks. So they told me, well, don't get too emotional, Jackie, or this is personal. I have fought 27 years. This is personal, folks. And if you don't see a system on the brink, we're not joking. They're out there ringing bells, for God's sake. This is ridiculous. We've got, and I'll chain myself to Bacteria Bear if I have to, I swear to God. Me and Bacteria Bear will become good friends. And people that know Jackie will chain herself to that stupid bear and get some kind of bacteria. So thank you for standing strong. Thank you for listening to us. I really don't want to be on that bear. And now I have to do Libby's speech, so I'm going to try to get myself into mode. And I just want you to know, Libby told me she spent all night crying because she has called 400 different people. And I told Libby, we're going to take a chill pill, and we're not going to cry, Libby. So, Libby, I suck. I'm sorry. Okay. Okay. Now she's laughing at me, and she'll calm me down. So this is Libby Drake. Her speech device isn't working because that's what happens. And she wants you to know she's STEP's employer advocate. She called 400 direct support professionals and 400 of her peers, between peers and the people supported, to tell them to be at the rallies, to fight for the 10%, to fight for anything. She personally, with her support staff, made 400 phone calls. So for all of you who don't make phone calls, she should be an embarrassment to you. So that's me just telling you about Libby Drake. Libby also says that in her speech, you've heard it before, is that training new staff is difficult. She has to do that. It's very personal to her. She has G-tubes. Could you imagine your most personal services? Showering, bathing, dressing, all that personal stuff. And she has to retrain and retrain and retrain. Thank God she has an extraordinary team right now. I don't know if she'll have an extraordinary team on January 1st. So am I good, Libby? Is it okay? Okay, I'm all right. Okay, thank you.
Thank you very much. Thank you, Libby.